Hey everyone, and welcome to the Autoimmune Dietitian YouTube channel. My name is Annie. I'm a registered dietitian and I work with clients struggling with autoimmune diseases. So, when I work with my clients, I help them use food and lifestyle as a way to improve their symptoms and hopefully get them back to where they were feeling before they were diagnosed. So, supplements can be super helpful when you live with an autoimmune disease. And I personally take a handful of them and find that they are really impactful at lowering inflammation and help support the lifestyle areas that I'm weak in. This month is dedicated to some of my favorite supplements. And today we are discussing milk thistle, a new addition to my supplement routine based on some recent research that I have done. So before I jump in, I just need to attach my usual disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes you make to your medical care. That includes supplements. Supplements can interact with other supplements, other herbs, other medications. So you do need to be very careful when you are adding supplements to your routine. So what is milk thistle? Milk thistle is an herb that is native to the Mediterranean region, and it belongs to the ragweed and daisy family of plants, and it has been used for centuries as a medicinal herb for liver support, blood cleansing and detoxification, digestive issues, and gallbladder support. The main active ingredient in milk thistle is silymarin. It is a flavonoid compound that acts as a very strong antioxidant and free radical scavenger in the body. Silymarin may also have immunomodulatory effects on the immune system. This herb also raises glutathione levels in the liver, which is the most potent antioxidant in the body. So what piqued my interest in using milk thistle was a recent randomized control trial using this herb to treat rheumatoid arthritis. This study took 122 patients with an active disease taking at least one form of conventional disease-modifying anti-rheumatic drugs, or DMARDs. People also had elevated C-reactive protein, and they weren't taking steroids or NSAIDs or any other anti-inflammatory supplements. The participants were divided into two groups, a control and an intervention, and the intervention group received 300 milligrams of silymarin for 8 weeks. Researchers measured the tender and swollen joint counts, morning stiffness, pain, global assessment of disease activity for both the patient and the physician, the sedimentation rate, and the C-reactive protein. They also looked at fatigue, depression, and anxiety using qualified questionnaires. After 8 weeks, both the tender and swollen joint measures, morning stiffness, pain, and disease activity assessment for both the physician and the patient were all significantly lower in the intervention group. In the control group, the pain intensity and disease activity assessment for both the patient and physician actually all increased, which I thought was really interesting. Another really interesting point here is that the sedimentation rate and the CRP for both lowered in the control group, but only the sedimentation rate declined slightly in their intervention group. The CRP for the intervention group actually increased slightly. So in terms of fatigue, depression, and anxiety, all of those improved on average for the intervention group, while slightly increasing for the control group. So overall, it appears that milk thistle supplementation helped participants with rheumatoid arthritis in only 8 weeks. This study was small, so larger studies would be warranted to confirm similar and consistent outcomes. Researchers also noted that the short duration may have limited the impact on the blood markers. And I also think it's really interesting that even the blood markers increased slightly, their disease activity still declined as well. So it's kind of when you go with more how the disease activity actually feels, or what your blood results show. Milk thistle may also be beneficial for lupus. So there was a case study that reported that a woman with lupus who later developed autoimmune hepatitis was forced to stop all medications except her 15 to 20 milligrams of prednisone due to adverse effects on her liver and overall health. So she was definitely having reactions to her medications. So prednisone was really the only thing that was she was able to tolerate. And as an alternative to using the medication, this woman started drinking milk thistle tea, and then later switched to capsules of 80 milligrams of silymarin and then 350 milligrams of milk thistle powder twice daily. After 6 months of this type of therapy, her liver enzymes actually dropped back down to normal levels. They were, elevated because of the autoimmune hepatitis and because of the medication that she was taking. So they normalized just by taking the milk thistle. She also was able to reduce her prednisone to 10 milligrams a day, and her liver disease stabilized, as did her lupus. She experienced no flares once she started taking the milk thistle. So again, very small study. This is just one case study, one instance of of how milk thistle helped someone with lupus. But again, kind of if it works for one person, it might work for you as well. So something to consider. And then multiple sclerosis is another condition that may be helped by milk thistle, although the evidence, again, not very strong. There's a study from 2021 which used mice with experimental autoimmune and encephalomyelitis, which is an animal model for MS. And using 10 to 20 milligrams per kilograms per day of silibin, which is a component of silymarin, the group that was treated with this compound had a slower disease development than the other group of mice. The treated mice also had lower inflammation and less demyelination than the control group. And it also appears that the silibin inhibited the immune cell activation and thus slowed down disease progression. Also, and lastly, they found that the silibin stopped T cell polarization, which is important for treating autoimmune diseases in general. So, should you take milk thistle? That's basically the bottom line. What should you do? Based on all these studies, milk thistle may be a medicinal herb to experiment with to help lower inflammation and disease activity. Because it belongs to the ragweed and daisy family, it should be avoided if you do have any allergies or sensitivities to these plants. Milk thistle is also used with a lot of liver conditions because it was for years it had been used as a way to detoxify and clean the blood, which is basically what your liver does. So if you do have any issues with your liver, it might be something to look into. But again, be very careful with adding any herb, making sure that your body can tolerate it. And like I said, there could be drug interactions, so important to check with your healthcare provider. The other thing that milk thistle may do as a side effect is lower your blood sugar, which is good if you do have high blood sugar. But if you are taking other medications or herbs that do the same thing, you do want to be careful because you don't want it to drop too much. So that is all I have on milk thistle. Super interesting supplement. I started taking it about a month ago just to see if it would help kind of with my joint stiffness. And I have one joint that tends to get kind of swollen here and there. So far it's working for me. I've had less swelling in my one finger joint. So I'm pretty happy with that. But if you would like more help figuring out supplements or reducing your inflammation, I would love to chat with you. If you go to my YouTube profile page, you will find a link there to book a free discovery call so you can learn more about how I work with people and what my offerings are and how I can help. So please check that out. If you don't subscribe to this channel already, please hit the little subscribe button. This summer has not been very consistent with my videos, but I will be back on track. I try to do a video every week. You can also follow me on Instagram, Facebook. I am there as well as the Autoimmune Dietitian, or Facebook is Annie Rubin Nutrition. You can also sign up for my weekly newsletter. That comes out to your inbox every Thursday morning. Again, there should be a link in my profile to sign up for that. So thank you so much for joining me. I appreciate you watching my channel, watching me. If there's any topics that you would like to learn more about, please drop it in the comments, shoot me a message. I would love to hear from you. And all this whole month of September, this is September 2024, we will be talking about different supplements. So stay tuned for that. Thanks again, and I'll see you next time.